What is your definition of depression? Hi, this is Dr. Neal, and today I want to take on the huge topic of depression. Before we get distracted by any diagnostic labels or stigmas, let's quickly disarm the word depression by saying that everyone, including you, is susceptible to a decreased mood, a decreased level of joy, and a decrease in the will to fight and thrive. Not only are we all susceptible, but I have found through 10 years of clinical observation that without the proper physical and emotional daily habits, mild depression is actually the default pathway or the norm for many societies. Look around you. Are the people at work, in your family, and in your neighborhood all thriving physically and emotionally? Are they peaceful, energetic, and content? Or are some thriving and some are suffering? In some towns, the majority are suffering, and in other towns, the majority are thriving. It all depends on the habits and actions that are being taken every single day. For example, you'll notice that a community that sits around and drinks a lot of alcohol will have a higher incidence of depression than a community that bikes and hikes a lot. Look around, travel around. You'll see how the obvious patterns emerge. Let's talk about your personal struggle for a moment. Are you feeling down this season? Are you considering or on antidepressant medication? Has your doctor given you a label or diagnosis? Do you think you are different than me or the people around you? If so, allow me to share what really may be going on. The reason you may be feeling low today is because your emotional and physical hygiene in the last 4 weeks has been non-optimal. Let's test if this hunch is correct. Have you worked out for 2 hours per day, every day, for the past 4 weeks? If not, expect depression, as like I said before, the default for humans that don't consciously and intensely move their body is depression. Obvious patterns emerge when you begin to observe this phenomenon, and that is why it is so easy to predict who is on the path towards depression. Now, for the rare Olympic athlete who is still depressed, of course there are more pieces to the puzzle. Like, do you have an unresolved childhood trauma? Are you living in an emotionally unhygienic relationship? Are you not balancing the hyperactivity or mania? Do you give love to those around you regularly? Although it's not one comprehensive answer for the entire approach to depression, there is the big piece of the pie, followed by the little pieces. The big piece is the physical activity level. The problem is that depressed souls find it very difficult to get physically active, and thus, the downward spiral of depression ensues. For example, think about an extreme case of depression when someone is hospitalized. What do you think lying in bed all day is going to do for a person's mood? Think about that. Notice how the core of the institutionalized psychiatric system is badly flawed. If someone is depressed with low energy, bed rest is the worst thing for them in the long run. Without focusing primarily on the physical activity level, one can quickly enter the downward spiral of medications, heady couch sessions, and trying to, quote, figure out your depression. I'll ask you, are you trying to figure out your depressed mood using your mind? If so, you may be in for a long, futile investigation. You see, depression is a physical and emotional sensation, not a thought coming from the conscious mind. It's a sensation. If you want a taste of a real antidepressant and a fighting chance to completely reverse this downward spiral, I have an experiment for you. Travel to a mountainous hiking trail and hike for over 4 hours with breaks as needed. When you get down, ask yourself one simple question. Do I feel better, worse, or the same? If you feel much better in that moment, you just learned of the real nature of depression. The reality is that you are in a year-round physical movement deficit. The earthy scene and fresh air also helps if you're in a Zen or meditation deficit. If you consider yourself inquisitive, try this experiment for yourself, and please email me the results. You may be shocked by what you learn. So the bottom line is this. Depression, while it feels like a mental thing, is really a physical and emotional sensation, and treating it from the mind will be a futile failure. My personal definition of not being depressed is when you wake up in the morning hungry and excited for the day. The diagnostic approach is as simple as that. If you're not excited for your day on a regular basis, consider you may be mildly depressed and in need of a bump up in both your physical activity and your emotional hygienic habits. I hope this video helps. If you're interested, I'd like to share with you my personal story of depression, anxiety, and general imbalance. I clearly remember being a very happy kid. I have always remembered the sensation of this pure childhood joy. However, through bad physical and emotional hygiene in my 20s and early 30s, I slowly but surely became depressed, anxious, and unable to find this joy that I consciously knew was missing. It was painful to feel tired, withdrawn, and crappy, and even more tormenting, remembering exactly what it felt like to feel awesome. Depression is pain. It's physical, it's emotional, and it eventually causes bad decisions and real chaos in one's life. In my mid-30s, I eventually found the joy I was looking for. It was as I had hoped. I had found the sensation of joy I had remembered as a child, and it felt right. I detailed how I found it in a video on the homepage called 5 Tips in the Pursuit of Happiness. I hope that video helps you.